How to keep your newborn puppies alive. After 30 years of breeding dogs, I'll share the things you can do to help a newborn puppy survive. If a puppy is having difficulty coming out, you can gently help it. But remember, the puppy is very delicate and small, and it can be born in any position. Make sure the puppy is able to breathe as soon as possible. First, remove any membranes from around the puppy's head, then dry the area around its mouth and nostrils. The first breath creates a strong negative pressure that helps inflate the lungs and triggers major changes in the puppy's circulation and breathing. This puppy is not breathing well. It is gasping for air. There is mucus or fluid in its airways. If the puppy is gasping for air or its breathing sounds rattly, hold the puppy's head lower for a moment. This can help mucus drain away. At the same time, gently suction the mucus with a soft bulb syringe. It is best to suction only through the mouth. Be careful not to injure the puppy. According to current recommendations, suctioning is not usually necessary for puppies that are breathing normally. Some puppies may need several seconds after birth before they suddenly take their first breath. Then, all of a sudden, the puppy takes its first breath on its own. If the puppy does not start breathing at all, give gentle rescue breaths. The heart may still be beating, so start gentle chest compressions only if rescue breaths don't help. This puppy appeared to have mucus in the airways. It made breathing difficult. Holding its head lower briefly, gentle suction, and gentle rubbing helped, and its breathing soon returned to normal. Squeeze the bulb syringe first, then gently place the tip into the mouth, then release the bulb to suction the mucus. Remove the bulb syringe from the mouth before squeezing it again. Minor bleeding from the umbilical stump usually stops on its own. However, puppies have very little blood, so bleeding must be stopped quickly. If the bleeding doesn't stop, clamp the umbilical stump with a clean clamp or tie it off with clean thread. The clamp and thread come off on their own as the umbilical stump dries. Warmth is essential for newborn puppies. Without external heat, they can develop hypothermia. A cold puppy cannot suckle properly. Being cold and unable to suckle can lead to life-threatening hypoglycemia. First, warm the puppy slowly. If you suspect low blood sugar, rub a small amount of honey or glucose on the gums. Puppies receive warmth from their mother, and they also cuddle together to keep warm. For healthy puppies, this and normal room temperature are often enough. However, the recommended environmental temperature during the first few days is around 32 degrees Celsius or 90 degrees Fahrenheit. The risks increase as the temperature drops. Canine Herpes Virus (CHV1) is common worldwide and can be fatal to newborn puppies. Keeping newborn puppies warm helps reduce the conditions that favor viral replication. As the puppy's body temperature rises, the virus has less favorable conditions for replication. A warm puppy is better able to fight canine herpes virus. The colder a puppy becomes, the more severe the disease is likely to be. Temperature management can significantly improve the survival of infected newborn puppies. You can warm one area of the whelping box to about 32 degrees Celsius, 90 degrees Fahrenheit, allowing the puppies to move to a cooler area if they need to. Moderate humidity is beneficial, and the mother helps keep the puppies hydrated by nursing them. However, a hypothermic puppy must always be warmed up slowly. On a few occasions, I have temporarily raised the room temperature to about 38 degrees Celsius, 100 degrees Fahrenheit, for 2 to 3 hours using the heat of the nearby sauna. This is based entirely on my own experience and is not a standard recommendation. It requires constant monitoring, experience, and that the puppies continue to nurse normally. It also requires close monitoring of the mother. In my own cases, it has produced good results. After 2 to 3 hours, I allowed normal room air from the rest of the house to flow into the puppy room so that the temperature could gradually return to normal. It is important that every puppy receives its mother's milk as soon as possible after birth. Puppies can begin nursing as they are born, once they are breathing well. Make sure the mother's nipples are clean, as they can easily become soiled during labor. If the nipples are soiled, gently wipe them clean. Do not use disinfectants. When puppies nurse, it stimulates the release of oxytocin and prolactin. The release of hormones strengthen uterine contractions, support milk production, and help the mother bond with her puppies. The first milk, called colostrum, is essential for a puppy's survival. It contains antibodies from the mother that help protect newborn puppies against disease during their first weeks of life. Newborn puppies can absorb these protective antibodies through their intestines only during the first 12 to 24 hours. The antibody absorption is most effective during the first few hours after birth and declines rapidly thereafter. Within about 24 to 48 hours after birth, the mother's colostrum gradually changes into regular milk. Pay special attention to the puppies born last, and make sure they also begin nursing soon, so they receive enough colostrum while antibody absorption is at its highest. Colostrum contains not only vital antibodies, but also highly concentrated nutrients that support the healthy growth and development of newborn puppies. Keep the whelping area clean and hygienic. Birth fluids, blood and placental tissue quickly soil the whelping box, bedding and the mother, creating favorable conditions for bacterial growth. As the puppy's fetal sac ruptures during labor, the mother will begin to pass birth fluids. The amniotic fluid inside each puppy's amniotic sac is usually fairly clear before birth, but during whelping it mixes with other materials. It may appear pink or reddish because of blood. Greenish fluid is common in dogs due to pigments released from the placenta. Brown amniotic fluid may indicate that the puppy has passed meconium, its first stool, before birth. This can be a sign of fetal stress. Some infectious agents as canine herpes virus can be transmitted during passage through birth canal or shortly afterward. In addition to this, the warm, humid environment of the whelping box and its bedding provides ideal conditions for bacteria and other microorganisms to multiply. That's why the whelping box must be kept clean, and the bedding must be replaced several times during labor. Birth fluids also soak into the mother's coat. When there is a suitable break, and no contractions, you can gently rinse the mother with body temperature water. If you use shampoo, choose a very mild product, such as a puppy shampoo. Finally, gently rinse the mother's nipples. Avoid exposing puppies to soap residue or other cleaning product residues. After the birth, continue to keep the mother clean, as postpartum discharge will continue. Rinse at least a couple of times. Don't forget to check and clean underneath the whelping box. The mother naturally keeps her puppies clean and removes their waste. Don't interfere too much with the mother's care of her puppies. Especially with a first-time mother, give her the opportunity to care for her first puppy from the first moments, if the puppy is breathing well. This is very important for the smooth progress of the whelping process. All of my dogs have known what to do when they were given the time and space to become familiar with their puppy. There is usually no need to rush cutting the umbilical cord, as soon as the puppy is breathing well. It is important to maintain a calm atmosphere and a quiet, stress-free environment. Normally, there is no need to interfere with the mother's natural care. My dogs seem to appreciate having a familiar person nearby for reassurance, or at the very least, to help keep the whelping box clean. Taking good care of the mother also benefits her puppies. On the day of whelping, the mother may have little or no interest in food, so I let her eat the placentas. They are rich in nutrients and hormones. If the whelping is long and many puppies are born, offer the mother small amounts of calcium-rich food such as cheese or lactose-free cultured buttermilk. Calcium supplements should not be given routinely. They can be harmful during whelping. Offer the mother fresh water during whelping, as she may be reluctant to leave her puppies to drink. A short calm walk in your own yard is perfectly acceptable and may help labor progress if it has slowed. The mother often needs a little encouragement to leave the whelping box. Offer the mother several nutritious meals a day, especially if she has a large litter. Her appetite will usually increase each day. Always provide fresh water, but place the bowl where the puppies cannot accidentally fall into it. Once the puppies have safely made it through the birth, the next step is to make sure every puppy gets a chance to nurse every 2 or 3 hours. At first, puppies often need help finding the nipple. With a large litter, it is often helpful to divide the puppies into 2 groups for nursing. Puppies start growing very soon after birth. If one puppy falls behind, you will usually notice it very quickly. This is an important warning sign. But if a puppy is simply smaller than its litter mates but continues to grow steadily at its own pace, is active and nurses well, that is usually not a cause for concern. Immediately after birth, puppies often have a strong will to survive. Problems often appear a little later. A puppy cannot stay latched onto the nipple, becomes chilled or separated from the rest of the litter. This is a critical situation. If a puppy cannot stay properly latched onto the nipple, one possible cause is cleft palate. However, in most cases, fading puppies have no obvious birth defects. They often fade quite quickly. Many breeders know this as fading puppy syndrome. In my experience, if no problems appear during the first 2 to 3 days and the puppies are growing well, you have usually made it through the most critical period. A vaccine against canine herpes virus is available in many countries. It is given twice during every pregnancy to protect the puppies. Check the puppies from time to time. The umbilical cord stump usually dries up and the navel heals within a few days. Their eyes and ear canals remain closed for about 10 to 14 days. During this time, the puppies rely on their sense of smell and touch to find their mother. When she is away, they naturally huddle together to keep warm and feel safe. Take your time, stay calm, and enjoy these unforgettable first days. Keep a close eye on the puppies and take good care of the mother. The love and care you give now lay the foundation for your puppy's future as cherished family members.